The following program does not offer personal medical advice. Please consult your doctor before using any treatment or product we cover. Welcome to Go to Health Media with your host, Jonathan Marks. We provide a welcoming environment where experts educate you on important health topics, answer your questions, and provide information from which you can benefit in consultation with your doctor. You can visit and subscribe to the show at gotohealthmedia.com. And now, here is Jonathan Marks. Hey everyone, this is Jonathan Marks, and welcome back to another episode of Go to Health. Did you know that over 1/3 of women say their oral health has declined as they have grown older, starting at the age of 40? As women age and begin menopause, oral health and hygiene become increasingly important. A change in hormone levels during menopause can cause gums to become swollen, irritated, and more susceptible to bleeding. Teeth are also more prone to plaque, leading to a higher risk for tooth decay, gingivitis, and advanced gum disease. So today we're going to discuss how to talk with your dentist about the impact of menopause and aging on your teeth and gums. Our guest is someone who should know all about this. Please welcome Sarah Chavarria. She's the Chief Executive Officer and President for Delta Dental Insurance Company, the leading dental insurance provider serving more than 31 million members. Sarah provides overall leadership and strategic direction for the organization, partnering with the executive leadership team and board of directors to deliver on the enterprise's purpose to improve health by providing access to quality care. Welcome to the show, Sarah. How are you today?
Oh, thank you so much for having me. I am fantastic.
Wonderful. So let me ask, how can women expect their oral health to change during menopause? What goes on?
So in menopause and even perimenopause, those estrogen levels drop, and those are the hormonal changes. And so things that women 40 and older can expect are some of the things you mentioned, but also burning tongue, dry mouth, receding gum line, and as you mentioned, that tooth decay. And so we know from this survey that we did this year of women 40 and older that more than half of these women do not yet make the connection between perimenopause, menopause, and their oral health, even though about 1/3 of them are having some of these symptoms.
Interesting. So your findings show that dentists are actually open to talking about menopause with their patients. I wouldn't think that would be something that would come up in a dental visit, but how can women have these discussions at their next dental visit?
Well, I was going to say, hold that thought, because while 84% of them said, yeah, we would be absolutely comfortable talking to our female patients,
Oh,
more than
good.
half of them said they would not initiate it. And
Ah,
so that is the gap that we have to bridge, right? So as women, we might not feel comfortable or confident walking into a semi-private space in our dentist's office and saying, hey, I'm in perimenopause or I'm menopausal.
right.
So what we recommend is maybe talk about the symptoms like, hey, I'm experiencing dry mouth, or I'm noticing some changes in my gums, to open that window and invite that conversation. And if that still feels a little uncomfortable, maybe you send an email the week before you go and say, hey, here are some of the things I'd like to talk about. We know that 64% of women 40 and older, they want that information from their dentist. They think it's a great piece of information to get from them. And
Mhm.
93%, they want it tailored to them, because no two women go through this the same.
Is it appropriate at all to talk with the office staff to mention that you're starting menopause? Is that an appropriate place, or should you wait only for the dentist if you don't feel comfortable exactly bringing it up with the dentist?
Oh, no, absolutely talk to the office staff, right? Because that office is taking, hopefully, they're doing like a healthcare intake form that they all have access to. And if
Mhm.
you feel comfortable because you've been talking to the office manager as you come in and go, absolutely let them kind of relay that information about what some of your expectations are for the visit. So don't be shy about that, for sure.
Great. So what changes are you hoping to see as more women learn about the links between menopause and their oral health?
So we're really encouraged already. The women who participated in this survey, of them, 82% said, oh my gosh, I'm going to go make my appointment and I'm going to see my dentist twice a year, which is fantastic.
Yes.
And most of them said, we're going to take better care of our oral health. So we feel really encouraged. Even from last year's survey, 2% of women 50 and older were talking to their dentist. 40 and older, 18% are talking to their dentist. So we are seeing some really encouraging movement in this space, largely because folks like yourselves are helping us talk about it and bring that awareness to women 40 and older.
Good. So why is it important to see a dentist to discuss these issues? I mean, if I'm starting menopause, I might want to think about seeing my primary doctor, but why should I be talking to my dentist?
Well, oral health is health. And, so I'm going to give an example that probably hardly anybody thinks about, and that is menopause can impact your oral health. And then your oral health, it can impact or it can have indications of your heart health. So
Hmm.
now think about cardiovascular disease. That visit that you have with your dentist twice a year and they're doing that oral health check, if they see changes in your gums, if they see potential gingivitis or periodontal disease indications, they're going to then have a pretty good grasp of, hey, you might want to go make an appointment and follow up on your heart health, which
Hmm.
is your overall health. And,
Hmm.
2/3 of the women we survey, they are absolutely not having that conversation because they're not making that connection. And that's why it's important. The other reason is we know that 27 million Americans forego their visit with their primary care physician. So their visit to the dentist, which they
Hmm.
are doing, it might be the only time they're talking to a healthcare provider. And so talk about your whole health there.
I've heard about this before, but tell us more, the connection between our dental health and our heart health. Tell us how that's connected.
Well, if you think about the fact that your mouth is connected to your body, there are absolute indicators. So if you start having, a disease show up in your mouth around, your gums, so you've got periodontal disease, or you have more plaque that, you're not going and having cleaning for, the dentist is going to be able to assess that and give you a lot of information about how that can impact your heart health. Your dentist might also do, mine does a thyroid screen, they do an oral cancer
Hmm.
screen, and it's not just heart health. We know that some of the things that a dentist might see already developing in your mouth could also point to things like diabetes and other things that we get really concerned about the older that we get.
Right, right. So that's really interesting to start seeing your dentist is more of a holistic healthcare provider. It's not just the
That
mouth.
That is exactly right. And I think that more than anything is what we want people to take away. It's not just for a cleaning. You're going in for an oral health screening, and
Hmm.
that oral health screening is a big part of your health and wellness.
Great. So if people want to learn more, the website I have, and let me just confirm this, is DDINS. So that's Delta Dental Insurance. That's all abbreviated. So
Yeah,
ddins.co/menopause.
that is right. My team's curated a lot of information on this topic so people can go to one place.
Great, wonderful. So we will make sure people have that link in our video when we publish it. Sarah Chavarria, she's the Chief Executive Officer and President for Delta Dental Insurance. Before we end, I wanted to ask you, is there a special rate for seniors that they can get at Delta Dental?
Absolutely. And there's a few avenues for that. You can look at AARP. We partner really closely with them to make sure that we create that access to care. And also you can buy it on the exchange. And so there are a few different places that we make sure we make that available. And you can go to our website and look for that information there as well. Just don't put the /menopause.
Okay, great. Thank you so much. Sarah Chavarria, Chief Executive Officer and President for Delta Dental Insurance. Thanks so much for being with us today and informing us about this connection between menopause and dental health, and also dental health and the rest of our health. It's been very, very helpful. Thanks again.
Oh, thank you for making this conversation possible.
Good. So remember, everybody, we'll be back with another episode that will help you with best health information from health experts. My name is Jonathan Marks, and as we always say, go to health. Take care, everybody. We'll see you again next time. Thank you for tuning in this week to Go to Health Media. Be sure to join Jonathan Marks and another health expert next time. You can also catch the program on your favorite podcast platform. Until our next show, be sure to visit us on the web at gotohealthmedia.com and elevate your life.